this scenario, a cancer patient, along with a nurse practitioner at a clinic on Virginia's Eastern Shore, places a follow-up telehealth call to a group of expert providers, including an oncologist, a physical therapist, a pharmacist, and a social worker. This interaction emphasizes the challenges of interprofessional group consults and how providers interact with the patient and each other.
Hey guys.
Ready.
Hey,
your earrings.
Dr. Rutledge.
Those are nice. Yeah.
Hey guys.
Oh wait, we got
Dr. Rutledge.
I think they're ready to start. You guys ready to start this session?
This is Jonathan and Micah calling from the Eastern Shore.
Okay. Gotcha. So yeah, you can hear us okay?
We can hear you. We can see you. Can you hear us? Can you see us?
So you want to tell us what's going on?
How's your pain?
It hurts a lot. I'm sorry. Who are you? What's your role?
I'm his physical therapist.
It's Sharon.
Yeah. I'm the PT.
Okay.
So, oh gosh. So have you been, oh, go ahead.
Tell us what's going on now. What's different since the last time we talked to y'all?
His pain has gotten worse. We can't control it. And he's also regressed back to using the wheelchair. He was walking last time he saw you all.
Any pharmacy advice, or do you think you guys, do you have any, what's he on now? Do you know what he's on, or?
He's on Cody, but...
Should we change that, or?
Yeah, we should probably give him something stronger.
So has he
And I'm
been
sorry,
like doing?
Who are you?
Is
Who is the lady that says
Hey
we should
guys,
change?
here's some pizza and cookies.
Oh, cool. That's great. Excuse us for a second. We haven't eaten in like 20 minutes, so.
Dr. Rutledge, can you secure your room, please? As this is this should be a confidential.
Close the door, is that what that means?
Yes, please.
Bam, okay, done.
Thank you. Who is the lady that was talking about the medicine?
Oh, me.
Yep.
Hi, and who are you? What are your credentials?
I'm a pharmacist.
Okay.
So you had him on codeine?
He's my patient. Yeah, I had him on codeine.
No.
Have you met her before? Do you know who she is? Okay.
What do you think, Grace? Do you have any input on?
But do you want stronger pain medicine? You kind of look like you need it right now. Okay, so yeah.
Looks like it's hurting.
Then I'll do a referral and I'll fax it over.
I really think he needs to come here to Norfolk so that he can follow up on his PT.
Yeah,
So
can he get over?
He needs some transportation services. He needs a Medicaid cab.
Can you work that out, or?
Yeah.
Okay.
Good. And who's the lady that said he needs a medic? We're not aware of.
My
who
name's
you all are.
Grace.
Micah's not.
I'm the
familiar.
social worker.
No, but he just needs medicine
Okay.
and he'll be okay. He doesn't need to come to physical therapy. He just needs more medicine to help with the pain, and then he'll be able to start walking again. And he'll get out of the wheelchair.
Can we do that by phone, or he needs to come?
He needs to come here.
No, I can fax over the prescription and they can just pick it up.
Sounds like he might need to come and work with you.
Yeah.
Okay. We'll get it all organized. Don't worry.
Get what organized?
Today, let's see,
we're not
by,
clear what you're
I think by next Tuesday, we should be able to get it all together.
Yeah.
Can we call you guys back after we just consult a little while and figure it out?
Yeah, because we also have to talk to
We understand.
Micah,
that
hang
you're
in there,
really
man.
busy.
We'll get to you.
Yeah, I'll
We'll
send
get to you
out the
soon.
prescription today or tomorrow.
I'm sorry. May I finish this sentence, please, before you interrupt me? What is the plan of care going to be, please?
Nurse practitioners are kind of uppity, aren't they? I'm married to one, and she's kind of like that too.
What'd you say?
What's that, Jonathan?
First off, I heard your comment about nurse practitioners. Second off, I was wanting to know what the patient's plan of care will be.
Yeah. Sorry.
What have we decided? I feel like we've not gotten anywhere with this case.
I was going to give him more meds.
And I'm going to see him. He's going to come here to Norfolk.
I'll get him transportation.
Right.
Yeah, but he just needs more meds for now.
Sound good? I'll sign off on everything.
Do you agree with that plan of care, Dr. Rutledge? Are you?
Yeah, it sounds like that would work out okay.
And
Micah's
going to
be feeling. He's going to be feeling much better pretty soon. Oh yeah, I saw that. Yeah, that was hilarious. So you got it? No?
You said you'll call back. You all need to discuss the case further.
Yeah, we're going to call on today's Tuesday, so next Tuesday.
And how will we arrange with everything? Is someone going to be in contact with Micah through this? Or are you going to contact my office and we'll be?
Yeah, we'll just call.
We'll give you a call. I'll have my secretary give you a call.
Or email.
Or email. Okay. Maybe a Facebook message or something? I mean...
That's so inappropriate.
Definitely.
Yeah, thank you for that. Okay, so I guess we're done. How do you feel about it?
I think we got it. This is the end of the session. You guys need anything else?
We're good. We're good.
All right. Peace. Let's do it again. Take 3.
Okay.
Hey, good afternoon, folks. I'm Dr. Jim Rutledge, the oncologist. Just wanted to just check in with you at the beginning here, so to be sure that you could see and hear us okay. We're really working on this technology to be sure it's working in all aspects. So can you hear us and see us okay?
We can hear you. We can see you. Can you hear us? Can you see us?
I sure can. Yes, thank you. We are starting this visit with my team here, and I want to be sure that I think we have on record consent. You do understand, Micah, the reason for the telehealth visit here to help you be comfortable and get healthy and get whatever support you need. So just want to be sure you understand the reason for our conference today.
Yes.
Okay. And so we'll count on you also, Jonathan, in filling us in on your assessment of things as we go through. What I'd like to do first is, and you may notice I'll be reading Micah's chart just to check on some things. Everybody here is prepared. They've read through the chart. We kind of have an update on where we are so far. I'd like to go around the table and be sure everybody's introduced themselves. So could we do that first?
Okay. Hi, Jonathan. Hi, Micah.
Hi.
I'm Sharon, and I'm a physical therapist.
I'm Gracie, I'm the social worker, and I will be taking notes throughout this visit as well.
And I'm Miranda. I'm your pharmacist.
Okay. You can still hear us okay?
Yes, sir. Yep.
Great. Okay. Well, one of the things we'd like to really start with is just to find out how things are going right now. If you could give us an update and let us know, your chief concerns or any questions you have.
There's just still like a lot of pain, and it's like really in my right leg. It feels like a 10, probably more than that.
Wow, okay. That's pretty significant. Has that gotten worse since the last time we spoke? I believe it has.
Yes.
Seems like it has. Okay. So we're trying to wean you off the codeine. You've been on it, and it's the pain has gotten worse. Is that correct?
Yes, sir.
Gotcha. Okay. Jonathan, could you or Micah, either one of us, kind of fill me in on mobility and other things that are going on?
So right now, and that's the other concern that we have, is he's regressed back to being in the wheelchair when a couple of weeks ago we had him on crutches and he was able to tolerate the pain with the crutches, and now he's not able to put any weight on that leg.
It sounds like things are headed in the wrong direction. As far as Sharon, maybe you can comment on the physical therapy aspect of how things are coming along. What are your thoughts on what's going on with Micah?
I just have a question for you, Micah. How have you been able to move around school? I understand that now you are confined to the wheelchair, but even prior to that?
I usually just have like a friend to wheel me around the classes. Before, like the doctor said, I have the crutches, but since it's gotten really bad, I can't walk anymore.
Wow, it sounds like the pain has gotten considerably worse since the last time we spoke, and I'm very concerned about that. Obviously, we want that to start to get reversed as much as we can. So perhaps we could hear, Sharon, do you have some input on maybe ways through physical therapy that we could help him?
Well, Micah, first of all, I'd just like to say I'm really sorry you're having such a difficult time, and it must be really difficult going from being mobile to now having to use a wheelchair. So again, I'm really sorry to hear that. I'm not really here to assess you in terms of what I can do for you with your physical therapy, but I can provide for you a telehealth evaluation, so we can do something one-on-one through telehealth, and then I could better be able to assess what your needs are, and then get you up and moving around again.
Does that sound like it'd be valuable, Micah?
Yes.
Good.
Good.
Do you think we could arrange that later today,
Yes,
Sharon?
we
Maybe
sure can.
maybe later this afternoon?
Yes.
Okay, that'd be great. Does that sound like a good approach? You're comfortable with that, Jonathan, as well?
Yep, sounds good.
All right. Well, we'll be sure we get that coordinated. After our visit today, we'll talk and be back with you definitely before the end of the day. Sound good? Okay. Well, good. Grace, I wanted to also touch base with you in case we need, and we're going to check in again within a week, all of us as a team. I'd like to kind of be sure that when we do need to see Micah again, that transportation is provided and that works out well. What's your thinking on how easily that can happen?
So I'm Grace, I'm the social worker again. I can help you, I can set up a Medicaid cab to help with transportation, and I hear that you're also in school right now. If you need accommodations for a bus or any special transportation services to and from school, I can help you with that as well.
Thank you.
That sound good? Any questions about that or how that works?
I don't think I have any right now.
We've worked a lot with Jonathan, so he's pretty familiar with how this works. So we'll count on him to be the point person there with you to help make sure that things go smoothly. So what I'd like to do is just be sure that we've answered your questions and that we've addressed your concerns. I think we have the potential to really get things more comfortable, especially with this physical therapy approach that we'll be doing a more detailed analysis of what you're doing and how to get you more comfortable. If we need to later on, we can coordinate with Miranda to change medications if that does come up. If the physical therapy isn't helping as much as we think it will, I'll be sure that Sharon shares with me your progress and lets us know what's happening there to be sure that you are indeed getting more comfortable. So does that sound good?
Yes.
Great. We're always open to feedback. I know that from a distance it can be a little different to deal with to coordinate with your team from afar. We've gotten pretty comfortable with it now, and we feel like we're getting some great results. So I just want to be sure that you feel like it's going well too. Seem to be? Good. Any questions from either one of you? Okay, great. We can wrap it up. Anybody else have any comments, or everybody feel pretty comfortable about our approach?
Hope you feel
Good.
better, Micah.
Okay.
Yeah, looking forward to working with you.
I think we're going to have another visit. We're going to definitely coordinate this within a week. We're going to be back as a team again, wrapping it up, making sure your progress is going along like it should be. Okay? You guys have a good afternoon.
Sounds good, thanks.
Good seeing you.
We can't emphasize enough the importance of being ready, whether it's just you on a telehealth consult or a group. The patient deserves your full attention. In a group consult, there must be a clear team leader who runs the session and facilitates the input from the other providers in the room. In the A scene, the oncologist, as team leader, confirms the consent form that both parties can hear and see, and that the patient fully understands the telehealth process. In fact, the whole atmosphere in the A session was much more calming and comfortable for the providers and the patient. In the F scene, when someone enters the consult room with pizza and cookies, that was not only a HIPAA violation, but also a big distractor. Privacy matters, so confirm that both ends of the telehealth session are secure with no interruptions, and put a sign on the door to the room that says Telehealth Consult in Session, do not enter. Don't eat, drink, or chew gum during a telehealth consult. It's rude and distracting. And we all have a habit of looking at incoming texts and emails, so put your mobile devices away. Nonverbal cues say a lot about what you think and feel. Consider how laid back Sharon, the physical therapist, is in the first scene, with lots of eye rolls, smirks, and other negative facial expressions flying around the room. Remember, there's a camera in the room, so they can see those faces. All of the providers maintain good eye contact during the A session, avoiding nonverbal communication mistakes altogether. When there is no team leader, people just jump right in, which is exactly what happened in this case. The leader can be anyone in the group, ideally the person that best fits the needs of the patient. At first, providers don't introduce themselves. There are awkward handoffs in the conversation flow. Providers have side conversations and crosstalk during the session, and they interrupt each other.
Do you have any input on?
But do you want
Helping.
stronger pain medicine?
When Dr. Rutledge takes control of the session, the conversation flows smoothly and there's little dead space. He lets Micah and Jonathan know that they may put their heads down occasionally to take notes or look at the chart. And reintroduce yourself and your role each time you address the patient.
So I'm Grace, I'm the social worker again. I can help you.
Don't talk about the patient. Talk to him or her. In the good scene, Sharon prompts Micah with motivational interviewing techniques, and the others present options and express concern for Micah's pain and worsening condition. Mics are sensitive and can pick up sidebar comments. Treat the remote site provider with professional respect.
First off, I heard your comment about nurse practitioners.
Consult him or her for input into the patient's care. After all, they are there with the patient. And again, use encouraging words and a compassionate tone of voice.
So wow, it sounds like the pain has gotten considerably worse since the last time we spoke, and I'm very concerned about that, obviously.
Empathy goes a long way in a telehealth session. The providers in the group consult exhibit pretty flippant attitudes, and their behaviors exhibit disinterest in Micah and his pain. In the A scene, the session is very patient-centric. Pay attention, smile, lean in, nod, and maintain eye contact. In the end, the providers are able to reassure Micah about any assistance he may need and provide care options. In a group telehealth consult, it's important to have a consensus for treatment so that the patient isn't left wondering what to do next. In the F case, the pharmacist and the physical therapist provide conflicting advice. There's no clear care plan or next steps, and the session ends abruptly.
This is the end of the session.
And it was pretty clear that not all of the providers are on board with telehealth. In the A version, there is good telehealth buy-in. Corrected, the group displays good interprofessional teamwork, a clear, coordinated care plan, and a timeline for follow-up. The session has a clear beginning, middle, and end, and is successful with additional telehealth visits to come.